Hello and welcome to Community Advocacy. I am Griselle Marino from the Office of Community Advocacy, and here with me are Renee Diaz, Executive Director of the Office of Community Advocacy, and Erica Coelho, Government Operations Consultant from the Florida Department of Health in Miami-Dade County, to give us a deeper understanding of the HIV and AIDS crisis in Miami-Dade County. Thank you so much for joining us.
Thank you.
Thank you, Griselle, for the invitation.
Director Diaz, welcome to the show. And what is the Office of Community Advocacy? We've been hosting the show, but there's always like new people watching. So, what does your office do?
Okay, thank you. The Office of Community Advocacy falls under the Board of County Commissioners, and is made up of 8 advisory boards. These advisory boards are composed by minority groups that their purpose, their mission is to promote the culture and to empower those groups to understand government and to feel that they're represented in the Board of County Commissioners in Miami-Dade County. We have 8 advisory boards. One is the Asian American Advisory Board, Black Affairs Advisory Board, the Commission for Women, the Community Relations Board, which is the oldest one that we have in Miami-Dade County, was created back in 1963. The Elder Affairs Advisory Board is made up of people 55 and older. Miami-Dade County has the highest population, or the highest number of people who are 62 years or older in Miami-Dade County, about close to 500,000 of them. We recently it was created by Commissioner Higgins, the LGBTQ board, and it's to perform the same functions as the other boards, is to empower, represent, and make sure that equality comes to that community of the LGBTQ. We also have, unfortunately, we need one that is called the Domestic Violence Oversight Board. Its function is actually to bring awareness as to the need that exists for those victims of domestic violence, find them shelter, relocation, and it's just and then they're going from the Board of County Commissioners and with those suggestions. And the last one but not least is actually the Hispanic Affairs Advisory Board, and that's what we do. We function. These boards are made up of volunteers. The volunteers are appointed by each commissioner. Each commissioner has can appoint 2 individuals to each board. So if anyone out there is interested in participating, find out who your commissioner is, reach out to them, and if they have an opening, I'm sure that they'll place you in.
And we also have in the office the Goodwill Ambassadors program that I understand that recently they were involved with assisting during the Super Bowl.
The Goodwill Ambassadors is the only program of its kind in the United States. It's made up of volunteers. These volunteers are professional county employees. They come from the police department, the corrections department, every department. I say corrections and police because it is important to mention that they also take time to volunteer aside from anyone in the administration. And the idea is just to perform. They receive training from FEMA. We do training with the CERT. All the Goodwill Ambassadors are CERT certified, which is CERT, which is community response emergency team, that they know how to respond in an emergency, go into a place and assess the situation. During the Super Bowl, the Goodwill Ambassadors were deployed, and they did play a very critical part in the process as to the Super Bowl reached out to a lot of volunteers, but sometimes the volunteers are not trained. So the Goodwill Ambassador were placed in key points, and one of the tasks was as well trying to minimize, if possible, and to identify if there was any human trafficking during the Super Bowl. So, the office is very much complete, and thank you for asking about the Goodwill Ambassador.
You're very welcome. Also, our Board of County Commissioners passed a resolution in 2017, I believe, about the Getting to Zero campaign, and they assigned the Office of Community Advocacy to work together with the Health Department towards the the need to reduce the number of HIV cases. Could you talk to us a little bit more about that type of partnership?
Yeah, in 2017, and you're right, in 2017, Commissioner Sally Hayman sponsored a resolution which was unanimously approved by by her colleagues on the dais. That is called the Getting to Zero Miami-Dade Counties and Awareness Week, and that is create a well. We've always had a partnership with the health department, except that this one established a I guess officialize the participation of the Office of Community Advocacy to work with the health department in promoting awareness to the HIV/AIDS epidemic in Miami-Dade County, and that's what we've been doing for the past 2 years.
Thank you. And that brings in Erica. Welcome to the show.
Hi, thank you, Griselle. I'm happy to be here and informing the public on what is going on in our county.
And one of the things that's going on, it's a new cases of HIV increasing and placing Miami-Dade County in the number one place in the nation, I hear.
Yeah, so Miami-Dade County leads the nation with the highest new HIV infection rates, right, in the county. So new cases of HIV. Currently, we have about 28,000 people living with HIV/AIDS in Miami. In 2018, which is the most current data that we have, we found over 1,000 people newly infected with HIV. Now, we created this campaign. Like you mentioned, in 2017, the resolution was passed. In 2018, we officially launched the campaign. So this campaign is an HIV/AIDS awareness campaign, right? It's a movement to reduce new HIV infections in Miami-Dade County and to reduce the stigma and discrimination. Unfortunately, we still have discrimination and stigma when it comes to HIV/AIDS. We work very closely with Renee's office and your office, Office of Community Advocacy. We've put media all over the trains, all over the buses, all over the county to create this awareness, right, that HIV still exists. There is no cure. There's still a lot of people that have misconceptions about HIV, how it's transmitted. But I just want people to know that there is no cure. Once you have HIV, you have HIV for the rest of your life. And for the rest of your life, you have to disclose that you have HIV, and you have to go to the doctor and make sure that you follow the proper medications and have the visits, the doctor's visits.
And one of the most important things in the campaign is like the testing part of it. Because if you don't test, you don't know if you're positive, and you don't know how to treat it or how to prevent giving it to someone else.
Yeah, so this year, so the first year it was just, the whole campaign is an awareness campaign, right? So the first year we focused on letting people know we have the highest incidence rates in Miami-Dade County. The second year we focused on PrEP and condoms, and I'll touch a little bit on PrEP later on. But then this year we're focusing on HIV testing, right? It's very important to get tested for HIV because that's the only way someone is going to know if they have HIV. The symptoms that you present are like flu symptoms, right? Like a fever, a cold. So it's very important to know your status. So that is the message that we want people to know, that to know their status. If you are HIV positive, to seek treatment. We have, if a person is positive, we have case managers that they're linked to, and they're linked to the case managers so that they can access the resources we have in our county. Aside from that, we link them to treatment, right? We link them to care. So the most important part of this is that if a person is positive, they need to take their medications, because that's how they're going to reduce their viral loads, and they're not going to transmit the virus. Very, very important that we get that message across.
And to know if the person is positive, or to get tested on February 19th, there's going to be a health fair that it's going to be offering the test. And I remember when I did the test last year, it was 15 minutes, but now you have the 1 minute testing.
Yeah, we have the 1 minute test. we have the event that you mentioned that we're going to have. It's a health fair at Government Center. It's what the address for that is 111 Northwest 1st Street, Miami, Florida 33128. The event is happening from 10 a.m. to 2 p.m. We're going to have about 40 providers there offering services, not just on HIV/AIDS, HIV test, but we're also going to have free condoms. We're going to have glucose screenings, blood pressure, cholesterol. We're even going to have dental screenings now for the first time. We didn't have them these past 2 years that we've held the health fair at Government Center. So I welcome everyone to attend. We'll be there from 10 to 2 on February 19th.
And talking about getting tested and following up with the prevention, the big news this year is that we're going to have 9 new wrappings. 2 years ago, we had the new one with the Miami-Dade logo, and now we have 9 new ones. Could you show them to the camera?
Yes, so I'm going to show just a few because we're going to be unveiling them on February 26th, which is another event that we're going to be having. It's an art exhibit. We're going to be displaying, we're going to be unveiling these condom wrappers and displaying some posters that we worked with the school to create on prevention messages, basically. This was the first design that we had on the campaign that we released this condom wrapper. It says Getting to Zero, and it has our website, www.testmiami.org. That's where people can go to get tested or receive free condoms, find a location near them to pick up condoms, or we can mail it to them. So if people are requesting condoms to be mailed to their home, they have to be 18 or older, and we send them a package of assorted condoms, lubricants, female condoms. So this was our first condom wrapper. Very exciting. This we developed this colorful and bold design to create a targeted message, right? Our message is getting to zero new HIV infections in Miami-Dade County. And it's extremely appealing. Everyone gets very excited to receive these condoms. We also worked with an art school, AIGA Miami, to design these other new 9 condom wrappers. So one of them, I can show you, is it says love yourself, protect yourself. You know, really taking control and making sure that you use protection and get tested.
So you've started the distribution of condoms had been with the health department for many, many years, but you've started this campaign with us 2 years ago. And I understand that 2 years later, the numbers have doubled in the distribution.
Yeah, we've increased significantly our condom distribution and testing here in Miami-Dade County, HIV testing. And that's thanks to all the campaign efforts that we've had throughout these 2 years. And thanks to your office for disseminating the information and really helping us inform the community and raise that awareness that's very needed. I think, one thing, Griselle, in our county that we encounter a lot when we're out doing outreach and informing the public that this is happening, and this still exists, and HIV is real, it's not something that we've gotten rid of, is that people don't believe it. There's still a lot of myths on how it's transmitted, or they don't know the resources that we have in our county, right? So a lot of people are surprised that we distribute free condoms in the community. We distributed about almost 4 million condoms last year. And people are accessing the resources now. They're becoming more aware of what's available in our county. They can look up locations where they can pick up condoms, or we can mail it to them, like I said, on www.testmiami.org, or they can reach us at 305-643-7420.
And you mentioned the ages. Minors are able to walk in and pick up condoms regardless of their age, but then for them to be mailed in, they have to be a certain age?
Yeah, correct. So to be mailed to them, they have to be 18 or older. And then if they go and pick them up at a location, they don't normally ask their age. Yeah. and this can be at a nail salon, at a barber shop, at a tattoo parlor. We have different non-traditional locations where people can pick up condoms. We also have clinics and hospitals, providers that are out. We have more than 300 locations where people can pick up condoms for free. We also have dispensers, condom dispensers in county facilities. We worked with the Office of Community Advocacy to make this possible, to make the condoms available and accessible in our community. And it's going really well. It's been extremely successful. So we're thinking about expanding it to other locations.
What are those county facilities, Renee?
These are every county facility that the public has access to. They go from downtown Miami, from the government building to Caleb Center. We're in the some libraries also. Libraries, I mean the main library in downtown. I believe in North Miami we have one. There's about 12 different locations. I haven't memorized all of them, but also in South Dade Government Center and the library there as well. Actually, near the station here at the at the planning and zoning and the permitting department. There's distribution place
Are
there.
they in the bathroom or are they
They're,
out?
no, they are inside the men's restroom. Right now, the only distribution that we're doing with
Not
the health
fair. Why not the women's restroom?
No, so we are looking to expand. So we wanted to see, this was a pilot. So we are trying to see how well it's gone. It's going to be the first year already that we launched it. So we are definitely going to be expanding and including them in the women's restrooms. There's some dispensers that are in between the restrooms, so they're outside. So like for example, in Caleb Center, we have them outside and accessible to both. We also have some in bars. We have one which is not a county facility, but I just wanted to mention, besides county facilities, we have dispensers in other areas throughout the county. We have one at Gramps in Wynwood. It's a bar. They have them in the women's restroom and in the men's restroom. So we have them in both right now. We have them in our STD clinics. We have them in our WIC clinics. We have them all throughout the county. Right now, we also have some at the University of Miami, so that's really exciting. This is the first time that we've put them in very visible locations in University of Miami, so we're thinking about expanding that into different universities and colleges throughout
like
the county.
Florida International University, Miami-Dade College.
Yeah, so it's the first time we're doing it, so we're going to see how it goes, and then we're going to move forward to implement them in other areas. Yeah.
Okay, going back to the testing, so if one receives a positive diagnosis and then this person does not have health insurance, what options are there for?
Yeah. Our most important thing that we do in the county is that we want in the state is that we want our community to practice safer sex and to stay healthy, right? We don't want to continue transmitting the HIV virus. So regardless of your immigration status, regardless if you don't have health insurance, we are going to give you the medication and the resources available in our county completely free. So that is what our goal is. Our goal is to reach no new HIV infections in the county, in Miami-Dade County, in the state, in the nation, right? So we want to end the HIV epidemic in the nation. So when somebody receives a positive diagnosis, we're going to link them to care. We're going to make sure that they receive the medication completely free. We're going to make sure that they receive all of our resources that we have to protect themselves and not expose them. Not transmit the virus. And we're going to make sure that they access all the other resources available. They're going to be linked to care, and they're going to see a case manager, and the case manager is going to give them all the resources that we have in the county, and they're going to give them therapy, right? So not therapy, they're going to give them advice and counseling. Yeah.
So the health department assists not only with those with a positive diagnosis, but also if someone receives a negative diagnosis, but they I have multiple sex partners, then you provide the prep for them. Is that how it works?
Yeah, so if a person receives a negative diagnosis, and we're going to give them all the resources available, right? And we're going to counsel them. We're going to provide them with counseling to make sure that they stay negative, right? And that they access the resources, that they get free condoms, that they get PrEP. So PrEP is a medication that prevents HIV. It does not prevent any other STDs, okay? So the other STDs like chlamydia, gonorrhea, and syphilis that are very common in our county, they're going to be, we always say that it's a toolkit, right? That you use PrEP and that you take PrEP and that you're going to use condoms, right? Hand in hand, because you're not going to prevent the other STDs that are very common. So PrEP, you do not need to have insurance. We have a medication assistance program that we make sure we tell the patient when they're getting tested. If they do have insurance, it goes through the insurance and it's covered through the insurance. The two medications that people are, know PrEP, because PrEP is pre-exposure prophylaxis. You're going to take this pill before getting infected. You have to have an HIV negative diagnosis. The two common pills are called Truvada or Descovy right now. We are dispensing the medication at the health department. People can visit us to know more information about PrEP. They can access the PrEP medication. They can go to our clinic at 1350 Northwest 14th Street, Miami, Florida 33125, or they can call us at 305-643-7420 and they can schedule an appointment. For PrEP, we recommend for people that are engaging in risky behavior, that have multiple sex partners, that are not using protection or not using condoms correctly or consistently. For somebody that has a partner that is HIV positive and that partner has not reached undetectable status, so that the viral loads are so low that they're not transmitting the virus, we recommend also for them to take PrEP.
And also there's an incubation period of 3 months, correct?
Yeah, so if a person engaged in the risky behavior, whether it's having sex without a condom or not using protection, practicing anal sex, vaginal sex, oral sex, we recommend for them to take PrEP.
Also, the use of drugs, right?
So and that's one of the common. Thank you. That's one of the common ways on how it's transmitted. Injection drug use, how HIV is transmitted in the United States. Besides sex without protection.
We're running out of time, but would you like to add something, Renee?
Yes, and thank you again for the opportunity. Like Erica said, there's no cure, and if there were to be a cure, it's only prevention. You have to prevent that this happen. There's only so much that the health department or the government entity can do, except just to bring this to the attention of the listeners and to the individual. If you want to live a healthy life, take the test. Make sure that you're not infected. And that you test negative. I mean, on the way here today, they had free gas at a gas station, and there was a big line for people to take advantage of the free gas, regardless of the brand. And this is, I think, the only thing that is for free that people shy away from it to take advantage of it.
Thank you.
I agree. I agree with Renee. And if you are engaging in risky behaviors, make sure to get tested and seek treatment, and we have the prevention tools available in our county. Access them,
Well, thank you so much for your time and for the work you've done in the county on behalf of this campaign, Renee, and for your 35 years of commitment to public service, since you'll be retiring soon in February. Thank you so much for allowing us to come to La Meca Radio and for me to host a show, and for us to bring the message of the Office of Community Advocacy and our boards to the public and to the community, so they know that we're the liaison between them and the Board of County Commissioners, that they could always come to our board meetings. It means a lot to us that you're being able to provide the service to the community, and that's one of the legacies that you leave behind as 35 years of service.
Thank you.
Thank
Uh,
you, Griselle, for having us here. It's really important to disseminate the information to the community, and I really appreciate that.
Thank you. Thank you to everyone in the health department for working so hard on the campaign. I know that usually during the month of February, we not only work with Black History Month and all of the events, but we also have the Get Into Zero campaign, and we've worked together in so many media interviews and dissemination and trying to get the message across. And like Renee said, with the gas, free gas, but these are free condoms, free HIV testing. If it's positive, we can help. If it's negative, we can help as well. So the health department is their resource. Once again, the number to call is 305-643-7420 for the health department. And for everyone, I thank you for tuning in on Thursdays and for our community advocacy show. My name is Griselle Marino. See you next time on Thursday and at 9 a.m. And the number to our office is 305-375-5730. And you could always find out about us through our website, www.miamidade.gov/advocacy. Thank you.